Hi, I'm Dr. Poray, chiropractor in Brooklyn for the last 27 years. I often get questions about adjusting children, like why do you adjust children? Does it hurt them? How often should you do it? Do you do it any differently for children than you would for adults? And how young can you start adjusting children? Well, the youngest child or the youngest patient I've ever had was 3 days old. But in general, I'd say that a child should be checked chiropractically sometime before they're 1 year old. Why? You might think that children don't have any problems. Well, in fact, if you think about it, children are far more physically active than we are as adults. They climb trees, they climb furniture, they climb each other. They're constantly falling down as they learn new skills in hockey, in dancing, or in the gymnasium. Now, if a vertebra becomes locked up in a small body that's changing and growing, it will affect their biomechanics and how they learn their sports in a negative way. Is an adjustment painful for a child? Well, we change the contact points and forces in order to accommodate children. This way we can accomplish the same thing that we do with adults, but with far less resistance and far less pain. Generally, we can adjust children just with fingertips and very little force, so that and because they are more flexible than we are, the adjustments are actually easier for children than they are for adults. In cases where normal adjustments that you may be used to are not appropriate, I'll use the neuromechanical adjusting instrument. For more information about that, I'd like you to check my website at www.drporay.com. Now, how often should kids be checked and adjusted? Well, like adults, all kids are different, but because children grow and change quickly, it's important to check them at least yearly. If you're monitoring something like scoliosis, which is a little bit different, then perhaps twice a year. And if you're dealing with a specific problem, then a series of perhaps 6 or 12 adjustments is usually enough. Now, should young athletes see a chiropractor? A lot of parents that I have come in feel that because their kids are in great shape, they don't really need to see a chiropractor. But in fact, the kids that are involved in these elite activities really need to see a chiropractor more than anybody. Young athletes are constantly placing their bodies at risk in collisions, falls, or in complicated skill acquisitions. So it's most important for these kids to see a sports chiropractor who understands their mechanics and who can keep their joints, their spines, and their muscles functioning optimally so that they can learn to sequence their new skills and to allow them to recover after competitions and training. So if you have any more specific questions about chiropractic and children, please contact me at the Brooklyn Family Health Centre at 905-655-5767 or check my website at www.drporay.com. Thanks.